lot of people get into nursing for the same ideals, that sense of wanting to help people and that sense of caring for each other.
Instead of moving away from illness, we're moving towards wellness, and that's really important.
FNHA works from a holistic perspective. We look at spiritual, physical, mental, emotional. We look at the whole wheel.
It's a different style of nursing. It's everything that nurses are brought up to be and embrace, a holistic approach.
I believe in the model of FNHA in empowering people and capacity building.
I think that's important from a grassroots point of view, to build rather than to have the old top-down approach. And it empowers people to want to take charge of their health care.
The very first thing that caught my eye with joining the resource team with FNHA is the chance to advance my career. We are going to obtain a remote nursing certificate, which allows us to practice at a enhanced scope. So it allows us to really enhance our nursing skills currently and try to just challenge ourselves and grow as a professional.
It's not just holding hands and doing medication. You can do surgery, you can do outpost nursing, you can do travel nursing. There's so many opportunities.
My name is Gary Housty. I am a registered nurse. I've worked in the healthcare field for about 14 years. I get to travel in my position and I get to go to communities and meet people.
You are caring for that whole generation, and I think it's a very unique opportunity because each First Nation has their uniqueness.
Going into a community, you get to learn about their values, their ambitions, what they want as a culture and as a community, and work towards that.
Working with FNHA, I am able to pull from my experience in working in mainstream healthcare, not to fit my agenda, but to fit the community.
It's nice to get out there and just mingle and be involved in their community events. I love the area. I love to fish. And I caught something and it started pulling and pulling. And I was telling everybody about it. And it wasn't until I spoke to one of the elders and he had said, "Silver slime?" And I said, "Yeah." And he goes, "You hooked into a whale." So that's my story. I caught a whale.
There is just a tremendous opportunity to work with people, to care for people, and to truly make a difference in people's lives.
And I've had that where I've gone to see an elder thinking I'm gonna, just go in and see how she's doing and just spend some time with her. And I come away from there thinking, wow, I can't believe I just had this most amazing experience. And I don't know if I helped her. I hope I did, because she certainly touched my heart.
It acknowledges culture, it acknowledges respect, it acknowledges community, and those are really powerful elements that this organization is growing into.
I think there are many rewards to working with our First Nations communities. One of the first that would come to mind is to have the opportunity to really become part of their family and to be part of a rich culture and a history that every First Nation community in British Columbia has. I think there are a lot of rewards in that, and also just the idea of having the opportunity to be part of a journey where we've taken back our health and we are really changing the future.
Giving kind of ownership back to the people that we serve.
Every community is very welcoming. They'll look out for you while you're there to look out for them.
I think I've always been a nurse, always helping and always being a part of the family, and actually working in communities. I don't know another job that I'd love more.
If you want to make a change, if you want to see something different, if you want to do what you were trained to do in the truest, most purest way you possibly can, then you have to work here. It'll be an adventure.
Hello, my name is Marlene. I'm the Director of Nursing at the First Nations Health Authority. If you're a registered nurse who's interested in working in First Nations communities, some of the most beautiful landscape on the planet, please, we'd love to hear from you.
Come join our First Nations Health Authority family.
Respect, relationships,
discipline,
excellence, fairness,
culture.